What's next is now that we have this patient pretty much closed in the treatment room, and they're not really closed until they know the money and they have scheduled an appointment. But what do we have to do now? We have to transfer this to an admin team, a treatment coordinator, someone, unless, like we did in our practice, we did all this in the back. We just went right ahead and scheduled the appointments and made the financial arrangement right there at the chair. Which is a cross-trained team, which is another conversation, but that's very effective because if you think about it, this is the most crucial time of the appointment and we're going to hand this off to somebody else who hasn't been in the conversation. So in order to do that effectively, we better have a good system for transferring this to the next person because we built a lot of trust here. We've built a relationship. We know the patient's story. We've seen on the scanner or the intraoral camera all of the conditions. We know what the patient has said and responded. And now we gotta give this patient to someone else to finish scheduling them and making the financial arrangement. That can be challenging. So we got to have a really, really good system for this. So Eric, we've called it transfer of power. We've called it, I know Ted Morgan calls it transfer of trust. And Dave Peer, it's not, let's put it this way, it's not a handoff, is it?
Yes, that gets fumbled. I call it transfer of care.
Oh, I like that.
Yeah, transfer of care, because you're empowering the next person in line to have the same level of relationship commitment with this person. So you're caring for them by doing it. But yeah, they all make sense. Power was empower the next person. Trust is I've earned something in this relationship. Let me give it to you. Yeah. Mm-hmm. It's not, all right, well, here you go. Needs a crown. All set. We'll see you in 6 months. All right. Tap the counter.
Yeah, that's the wrong one.
All right, bye. That's the dump off. That's the handoff. That doesn't work.
And when we talk about cancellations, we talk about reason for return, reason to return, RTR, RFR, whichever. Yeah. In Alabama, they don't, they like RTR, roll tide roll. But, we've got to give the reason to come back, which is condition related. That's what really speaks to the patient is those conditions. So this page right here, page 60 is where we are, and it's talking about, and this is a fun thing to do, and I've done this with teams before. You're walking into a movie an hour late. And some of you, maybe you don't walk in the theater to a movie an hour late anymore, but you're flipping channels and you start a movie an hour late. And you kind of like, who's the good guy? Who's the bad guy? What's the storyline here? Where's the love triangle? And it's difficult to get caught up when you've walked into a movie an hour late. So sometimes I'll take a video of a commercial, a short commercial clip or something, and only one person sees it. And then the team comes back in the room and we have to share what we saw on the clip with the team. We have to transfer what we watched from the clip to the team. That's a good exercise in practicing this transfer that we're talking about. So there are some scripts here if you want to play around with these. And why am I calling it the doctor? The doctor is really about the hygiene exam. A lot of hygienists have been trained, don't say anything to the patient. You can't diagnose. Don't say anything to the patient about what's going on in their mouth and wait for the doctor to do everything. Well, the doctor's walking in an hour late to this show and to this movie, and they don't know what's been going on. We're going to have to tell them. So I like something like this. Let's say, Eric, that you're the hygienist and I'm Polly and we've been talking about this stuff and the doctor comes in for the exam and you've got to relay all this. We just want the doctor, we can pretty much predict. And here's an action plan. A lot of you have, action item, a lot of you have new team members on your team right now. So I'm going to suggest that you write a document, and I have a sample if you want one, of treatment planning predictability. What do you usually do in certain situations when conditions are present? How do you treatment plan? Let your new team members know this so they can predict most accurately to the patient what you might say. Okay? Now, this is at your comfort level, of course, but what can happen here is we can save a lot of time if we can predict, well, what doctor usually says that he'll do for this or she'll do for this is this. So,
Typically.
Eric, in the scenario we've been in, how would you transfer, let's say Dr. Dan just walked in the room, and how would you transfer me as a patient?
And so I want you guys to listen for three things. I'm going to talk about the condition. I'm going to focus on that. Okay. All right. Because people don't buy a solution to a problem they don't perceive to have. I'm going to focus on why it's important for Polly, right? I'm going to make sure that I transfer her why. Okay. And I'm going to let my next team member know, in this case, the doctor, what commitment we have moving forward. It could be just to diagnosis. It could be commitment to, yeah, we have a problem. It could be no commitment at all. But those are the big three things I'm going to hit here. You can see conditions, you can see DBM, dominant body mode, that's the why. You can see commitment to treatment, whatever that commitment is. I'm going to transfer those three things. You're going to hear that here because I'm not doing treatment planning. I'm not talking about appointment times yet. This is more like, this is, you're looking at like maybe admin or something, you're transferring out front, but this is a clinical to clinical. So are you the patient still, Paula?
Yeah.
Okay.
Yeah.
So we have an imaginary doctor walk in. Dr. Morrell walks in, and I say, hi, Dr. Morrell. You remember Polly? Yeah. And so, or maybe you're a new patient still. Let's keep it simple, right? This is Polly. Nice to introduce you. I'm going to verify that research. Remember she talked to Heidi on the phone. That boom, boom, boom. I'm going to hit the few things. Now Polly knows that Dr. Morrell knows all of it, and Dr. Morrell finally remembers everything. Even though we talked about it morning huddle, he's been thinking about molar endo on number 3 for the last hour. So he's not remembering what we're doing right now. So I'm setting him up for success. Okay. So I say, Dr. Morrell, Polly and I were talking, and her and I are both really concerned about the health of her gums. She has severe bone loss on some teeth in the back, and that's causing recession. We talked about being long in the tooth and what that looks like. And she remembers some of people she's known who have lost their teeth, and how, it's really, really important for her to have a confident smile moving forward. And we talked about the conflict there, those two things. How can you have this confident smile with overcoming some past concerns with how it looks and still have this infection cause it to deteriorate? And so she really wants you to take a look, confirm what I'm seeing, give her an idea of what the best course of action is to save her teeth, so that she can move towards that confident smile. Does that sound right, Polly?
Yeah, that's right. I mean, I know that there's some things I was a little bit surprised, but I understand what's happening because he showed me, and I get it. I need to do something. Yeah. So I'd like to know what you think. So this is just setting the doctor up for success right here. And if you have an approval addicted doctor, and you're letting the doctor know that the patient is ready to move forward, that's going to help your doctor, not withhold or say, we'll just watch it. True? Because the patient has said they're ready to move forward.
Well, and your doctor's wondering, what am I walking into here? Am I walking into someone who's on board? Am I walking into someone I got to really focus and emphasize the concern, or do I have someone who's really on board already? Okay.
And this is going to save a lot of time for the doctor because, they've got a restorative patient in the chair and maybe another hygiene exam to do. And if we're not preparing the doctor for what's been going on, this can take a long time. And we don't have time for that, do we? Yeah. So that's why we call it the doctor, because, hopefully we've got the patient prepared for what the next step is, and the doctor's agreeing, yes, I believe you're right, and you predicted that really well.
And here's all the wrong ways. I've seen it the wrong ways a lot of times. Hygienist isn't even in the room.
Oh, man.
Right? Doctor was running late to get to the room, and she's already moved on to the next chair. Oh, okay, goodness. Why do we have another, there's something broken in our system. If you can't do this, there's something broken in your process. The other way is the hygienist just stands there. Doctor comes in and just discovers all by themselves, right?
Yep. Okay, so, we gotta.
That is not okay either. I hate saying that, but that's not okay. And then, or doctor walks in and we go, Yeah, doctor, there's a periotype 2, and I've recommended 4 quads of scaling and route planning. And if you could just look at that and confirm, please.
Yeah.
Like, that's not
Or
okay either.
I wrote some notes for you on the napkin behind the patient's head.
Yeah.
Yeah, we see
Yeah.
those things. So this is super important right here. And so what's the action item? The action item here is to take a checklist, the 3 things Eric mentioned: conditions, why, and commitment, and maybe this checklist and some of these scripts that you see right here, and practice with your team. Practice with your team. If you don't practice, Eric, do you think you can become an expert at playing basketball from just watching a video?
I think it's funny. I know they're really not bragging here, but I know, Paula, you hear this all the time. Can you just come work in our office? I hear team members say this all the time. Can you just come and do this in our office all the time?
Yeah.
You're so good at it. Well, it's not a fair comparison. Paula and I talk about this it'd be like me saying, wow, let me start cleaning teeth. Oh, hygienist, can you just come clean teeth? You're much better at it. You do it all day long. It's the same thing. You're focused on treatment and caring for patients. I'm focused on this skill all day long with people. And
Yeah.
because I've practiced it for 20 years, we get good at it. You've got to practice it. Once you get in the habit of practicing this and role playing or just in the mirror, in the car, whatever it is, with a team member, practice it. You will create new habits. I'm reading Atomic Habits by James Clear, Paula. Such a good book. I know a lot of people have read it that are here. And he just talks atomic habits, little things you do that when you stack all those little things together, make a big impact. And you really just can't say, oh, I'll do this right now. I'll start doing this the correct way. You actually have to create a new habit. Okay. And he takes you through that process of how to create a habit. It's excellent book for implementing new skills, implementing new habits.
And how do you break a bad habit? You really can't. You have to replace it with a good one. Right?
Yeah.
If you don't replace it, I mean, there are people who will go through like stop smoking or whatever, and they have to replace that by chewing gum or a mint or something to help them stop. So we can't just stop doing the things that don't work. We have to replace those things with something that does work, and it takes practice.
The biggest thing that I want us to hear in connection with this is that definition of insanity, doing the same thing over and over again, expecting a different result. If you keep getting cancellations in your hygiene schedule because people say, oh, it's just a cleaning. Okay. There's your sign. That's a sign or a symptom that something's wrong. Understand something. The results we get come from the actions we take. And a lot of times people stop there and go, results, actions. Okay. But actually, the actions we take come from the beliefs we have. So it goes results. Underneath that, actions are pushing to create results. Underneath that, beliefs are driving our actions. Oh, I can't do that. I could never say that.
That goes back to the junk page we had in our manual when we were talking about that.
Your beliefs, if you can't implement this, your beliefs about implementing it may be in the way, and you need to tackle the belief part. Then the actions, the habits will start showing up correctly. Then the results will ensue. If you're in a practice and it's just comparing 2 people and the production, let's say 2 doctors, one's producing X and one's producing Y, but you're seeing the same patients. You start to develop a belief. Well, I can never be that, or I can't do that. Whatever it is, doesn't matter. That's a belief that's restricting your action. You first got to deal with that. And the second thing is, then you go, well, I don't want to. That doesn't sound like me. I don't want to do that. I don't like saying those things that Paul and Eric talk about. But doctor up here is doing these things. You got to start questioning your belief about that. If you can tackle your belief on that, then you'll start changing the action. Paula, I mean, I'm really not trying to pick on anybody here, but I feel the freedom to just speak something. There's always one. There's always one person on the team. There's always one person that creates this is silly, or we can't do this, and they have their own belief about it, and it starts to infect the rest of the team. And
You know, I
that,
had a call with somebody yesterday, Eric. They're not in this group.
yeah,
Uh, that very same thing.
yeah,
This is a 5-star team member, and they've got one turkey, and that's exactly what's going on.
yeah. I did the presentation to the big group in Florida, 200 people in the room, and I'm working the room. I'm connecting with people. I'm making eye contact. And there's literally one person on her phone the whole time like this.
Oh,
It's just driving the momentum, the team down. You have to work on the belief before the actions will show up. And that's a personal thing for you to do. So I'm calling on you if you have doubts about this. It could be negativity, it could be self confidence, it could be, oh, that'll never work, or whatever it is. If you have something, some barrier in your belief system, you'll never get to action. Therefore, you'll never get the results. We'll talk about this with insurance later today, too.
oh boy.
Yeah.
Preach it, Eric. Preach
Yeah.
it.
I'm getting
Yeah.
hot. I'm catching fire, Paula. I'm waking
This
up.
is
It's
good.
8:30 here.
Yeah, it's about lunchtime for me. So, yeah, this is awesome stuff, and it goes right back to part one. That's why I'm pulling up these pages
Yeah.
of what he's talking about, that relates back to what we talked about in the beginning. I just want you to connect the dots.
Yes.
That was the foundation to be able to do the things that we're talking about today, to follow the system and implement it.
That's
So,
why day one's day one and not day two. You got to
hey,
have that
hey,
done first before you can do these things. So
you think?
what's mentally getting in your way? Okay.
There you go. Very good. Very good. I love it. I love it. Okay, so now after we transfer this patient, we may end up. Now we've got pages right here on systems and reports to review. But where we're going to go next, because we're going to come back to this section a little bit later, is we're going to go into objections.
I gotta say, I love the meme on page 61. It's the guy on the phone. I'm just
Oh
gonna
yeah.
ask you a few questions so I can transfer you to the right department. They will ask you the exact same questions and be of no help. I love that. Oh my gosh. I do we do the role plays when Paul and I do this live, and I'm the admin person and they're bringing the transfer out and there's like this dump off, like, all right, I got to go, I got to take off. And I'm the person on the phone. I go, oh yeah, I don't have any time to check you out anyway. I'm trying to fill a schedule. We had a cancellation, the reason we had a cancellation, Phil, is because we're not doing the transfer. We're circular on this, so we can't figure out how to stop it. It actually has to do with you can call it whatever you want, NLP programming. It could be you teach people how to treat you. The results you're getting are based upon the actions you're taking, because you have a belief that that's not important. Oh, but by the way, Paula, I'd like to get a raise this year. But I'm not doing more. It's just been a year. I'd like a raise. I'm challenging everyone listening. I want you to have ownership in this. You will get phenomenal results, and people will be offering you raises. You won't have to ask for them.
This is true. This is true. It's so true. I mean, with inflation at between 7 and 12% right now, and doctors are raising fees, and team members see production going up, but they don't realize their break-even point is even higher than it was last year.
And the doctors are part of that team.
Yes.
I want to make more. Well, then you got to do something different.
Yeah.
You got to do something different. That's that insanity that's getting in the way. So
It absolutely is. Good points, Eric. Thank you for preaching. So what happens now? Let's look at this page 69. Is after we have transferred this patient to the front, to the admin team, or if we're checking them out and scheduling them in the treatment room or a consult room. And here's three things in order of importance. If you're checking out a patient, the most effective, the best place to check out a patient is in the treatment room. Okay? That's where you get the most acceptance, because they're with the people that discovered the conditions and discovered their why. Okay? Now, as an admin person, sometimes I would go to the treatment room, and I know there's all kinds of logistics you have to work out here, but sometimes I would go to the treatment room if they needed my help. Okay? The second best place to check out a patient is the consult room. Okay? Many teams have consult rooms that are empty. They're just sitting there. They use them maybe once, twice a day, but they're just sitting there. Those consult rooms should be used all day long. In our practice, we had 16 treatment rooms. We had 4 consult rooms. They were used all day long. Consult room is the second best place to check out the patient. The last resort is the front desk. Why? Because they're noisy. The patient, as soon as you take off the bib, you've lost their attention. They've got their cell phone out. They're on their feet. They're ready to go to their car. Your body language, your haragay, you've got a team member sitting down. You got a patient with a counter in between standing over you, telling you what they're going to do and what they're not going to do. It's not as effective to check out a patient at the front desk. So please reconsider your system of the treatment room, the consult room, or last resort up front.
And maybe there's a semi-private area up front. That would be ideal, where you could, more than where the reception area is. Yeah.
Exactly. And there's a lot of over here. When we're talking about the transfer and we want to transfer those conditions, one of the objections we get, Eric and I get, is, well, there's people out there in the reception area and they can hear all of this. All the more reason to don't check them out up there. Make sense? I mean, absolutely we don't want people in the reception area hearing what we're going to say about they have a broken tooth and, they want revenge on their parents and all this kind of stuff. Of course, that's a private conversation. So why are we having that in a public area? So let's rethink what we're doing. Let's rethink. I've had people knock out walls and move desks and all kinds of stuff to create a more private atmosphere for this. So let's say we've transferred now, or even if we are checking out in the treatment room, and we have objections from the patients. There are 6 objections. Let's go back up one page. Page 68. There are 6 objections, and the 6th one is not listed here. I'm going to see if you can guess it. I mentioned it earlier. If you were listening, you might have caught it.
For 100 points. For 100 points.
For 100 points, right. See if you get any chats over this, Eric. We've got time. I don't have time for that. I mean, that's definitely one of my objections. I'm busy. I'm on coaching calls or doing Zoom all day long, every day. Going to the dentist is a challenge, or going to anywhere. Haircut, doesn't matter. Don't have the money. Sometimes I feel like, Eric, I don't have the time and I have the money, or I have the money and I don't have the time.
Probably connected. Those are probably things that are connected. You have a lot of time on your hands because you ain't working. So you probably.
I got all this time and I ain't got no money, or I got money but I ain't got no time. Yeah, I know a lot of people like that. Are they afraid? Their past dental experiences. I mean, a lot of people. We've got all 3 of these objections. Some of your patients have all of these at the same time. Lack of urgency. We talked about that earlier. Of like, it ain't broke, don't fix it. It ain't hurting me. What'd you say? No pain?
No pain, therefore no problem, then I'm not going to pay. No pain, no problem, no pay.
There you go. So that's lack of urgency. That's Eric's PPP.
So it shows up as a money objection because I'm not going to pay you. I can't afford that. But really, if you backtrack it, it's, well, I don't perceive I have a problem because I don't have any pain. That is a prevention objection. That is, we didn't sell the condition and consequences in the 95-5 rule and the over psychology and the limiting terms. That's why that showed up. And now you're asking an administrative person to diagnose and get the patient to buy into that diagnosis with them. And there's not a lot of clout there to do that.
You know what, Eric? I really can't afford to buy things that I don't want.
Yeah. Well,
if I don't want it, I'm going to say I can't afford it.
But if you want it, you'll find a way to afford it.
Oh yeah. If I want it, man, I'm working on it. I'm figuring it out. And I usually ask teams, raise your hand if you bought something you couldn't afford. Who has been shopping and bought something they couldn't afford? Yeah. Why did you do that? You did that because you wanted it. So the financial arrangement is important, and being able to finance patients and all that kind of thing. But if they don't want it, you could give, we've offered free treatment to some patients and they still won't do it. I have a friend that I volunteered to pay, and I did pay. For 2 years, they said no. For 2 years, they said no to free treatment. Okay? We think money is the biggest objection. It isn't.
You have people who tell you stories about their vacation they're going on, the new car they bought, the home renovation they just did. And then they tell you, oh, yeah, no, I can't afford that. It's just
Yeah,
an excuse. It's not the objection.
exactly. So there's also lack of trust. Maybe they're a new patient with you or they feel like you didn't listen, which is the system is built to build trust. With the SWOT, the phone call, the emotional exam we went through, finding out what their why is. And the last one, oh my goodness, I see this one happen a lot, especially with larger cases, which Jen is going to talk about in March on our doctor office manager.
That's right. That's
Yeah,
right. Yep.
closing large cases.
Yep.
One of the biggest objections I see here is confusion. We've presented, like I said earlier, we presented 2 and 3 treatment plan options, and we're busy explaining and we're talking all over the place, and we've lost them. And they just go home and say, I got to think about it because they're totally confused.
Now, I want to say something. I won't treatment plan another option, but I will talk about another option that's less than ideal and why it's less than ideal, right? They're like, well,
Yes.
there's another option. Well, yeah, you could do something that's removable or partial, and here's how that works, and here's how that doesn't work. Yeah.
And then you ask them, which one do you choose? And then
Yep.
you create your treatment plan. Giving options is essential. You must do that. Legally, you have to do that. But writing up 2 treatment plans is not, because we want to know what they decide before they leave. Okay, so here's your 6 objections, and we hear them all over the place. And so how do we respond? So let's take a few. Here's a simple. Sometimes we use the 5-step. Listen, cushion, question, answer,
Yep.
confirm, but this is just 3 steps. Eric,
Yeah,
what do you?
I love 3 steps. So much easier. Just listen, hear them, relate to them, cushion it, and then ask questions. Just dig into question mode, question mode. The answer will show up. Or it's a life condition, and that's what you discover. I want to do it, I can't do it.
Yeah.
Right?
I
Lost.
mean, like, COVID has been one of those. Although some patients are faking it, we know that. But so here's a little tip. We may talk about this in cancellations. I don't know. Somebody calls and says, "I can't come because I'm sick." In all of our team meetings, we signed boxes of get well cards. The whole team signed them, and so we had them ready to mail out. And if they're lying, they felt guilty that the whole team signed a card for them. So
Yeah.
anyway,
Yeah.
all right. So what objection would you like to start with, Eric, that we can practice?
I think a money objection that's really lack of urgency. So someone says, I can't afford that.
Okay. So do you want me to be the patient, or do you want to?
Yeah, sure. You be the patient. So
Okay.
Paula, how do you feel about moving forward with this and this plan that you and doctor talked about?
Well, right now it's just a lot of money. I don't really think I can afford that.
Let's back up. Let's say I'm clinical. Let's say I'm at close, right? I'm at mutual agreement, and I'm the doctor. Okay, it's a money objection that you hear, and you're going, oh, I don't talk money. Okay, this is someone else's problem, right? Okay, but I'm the doctor. Okay, so Paula, how do you feel about moving forward with this?
No, I'm not sure I could really afford this.
Keep in mind we haven't even talked about money yet, right? There's your first sign. She's throwing me an objection that she doesn't even know the answer to.
Sounds like it's going to be expensive.
Yeah, I get it. I hear what you're saying when it comes to wondering about cost for medical expenses in general. I hear you. Let me ask you this. When you think about everything we've talked about and you think about the plan, what is it about it that you feel is most important to you, that you want to do and you feel is urgent to do?
It's a good question. I think probably the infection part you said that's in my gums.
Yeah. And why is that the most important part, you think, for you?
Well, because when you said that I'm swallowing that and it can spread and all
Okay.
that kind of stuff, I was just like,
Got
ugh.
it. Got it.
I didn't
Okay.
realize how serious that was. Yeah.
So you feel concerned enough about that to get that taken care of. That part we feel good about. You feel like that. I mean, we don't know the cost yet. We haven't gone over that, but you feel like that could work. But you said something's expensive? What's the part that you're disconnecting with here that you feel like is not going to work for you, that you feel like is not important to do right now?
Well, I just don't know if I really want to go through all that, getting my wisdom teeth out and, all that kind of stuff. I mean, I don't know. That just sounds like a lot. And,
Not a money objection anymore. I'm so glad I didn't transfer you out to Heidi, because she's not going to be able to talk to you about this. Only I can talk to you about this. Right?
Yep.
And here's the funny part about this. That means I didn't do something earlier to get the buy-in, and I'm having to replay it. So I don't want to hear how, well, that's going to take too much time for me to have that conversation with them. The reason it's taking too much time is because you didn't do something earlier. So this will train you to go, I don't like this, Pavlov's dogs. I don't like this experience. I'm going to do a better job earlier. I'm going to get more buy-in earlier.
That's right.
So now I got to decide if I'm going to back up. I'm going to take care of it a different way. Okay. So Paula, let's talk about the wisdom teeth. I totally get it. At what point do you feel like it's going to be a big enough deal for you to want to do something about them? Because right now you don't feel like that's the case, right?
Yeah, I mean, I don't want another root canal, but I guess if it's really affecting another tooth, and I get pain.
Yeah. So here's the issue. It's not an if it's going to happen, it's when it's going to happen. That's the real question here. So when I always tell people, as long as you get it done the day before it hurts, you're going to be fine. Right? And I can't
know when that is, huh?
I can't tell you when that is. So what do you want to do about that? What sort of risk do you want to assume with the root canal versus being proactive and affording it? We can still talk about that too, right?
Yeah, I really don't want to get into a toothache situation again. So you're right. I just need to bite the bullet and do it.
Well, let me say this. Maybe the bullet's not going to be as painful as you think. Maybe we can figure out a way to make this doable for you so it's convenient and easy and you don't feel anything. What can we do to do that for you? Is it something I can do to make sure you're comfortable and not stressed in the dental chair? Is it something financial?
We'll need lots of nitrous and maybe spread out my appointment so I'm not here at a long time all at once.
I really appreciate you sharing me with that. Why don't we see if we can figure this out with Heidi then? Let's see if we can put all this together. How does that sound?
Sounds good.
Okay. You can't do that if you're not willing to engage.
That's right.
I dropped the ball. I must have lost them. I've got 4 patients waiting for me in the other exam rooms. Maybe I'll get one of them to say yes. And that's what the pressure we get in a dental office. We get so busy. There's so many patients going on that we don't take the time. Now that took 4 minutes. And that's 4 minutes that I probably would have spent just better invested in my discovery process where the patient's co-discovering a diagnosis and selling it, but it didn't happen. So now I got to do it here. So it was time not well spent that now will be well spent.
That's right. You did a great job, Eric. That was great.
It's just a conversation. It's just asking questions. It's just a conversation. I hear you. I see where you're coming from. Let me ask you this. That's all I did. Just
applying those principles that we've been talking about all the way through. So let's take some other objections and play those. Like one of my favorites, I'll do this one with you, is like, will my insurance cover it? So Eric, you be the patient, and we'll just take some, makeup scenario here, and you're going to ask me. So I'm the hygienist, and we just treatment plan you, and you're saying, is my insurance going to cover it? You're asking me this in the treatment room.
Yeah. Okay. You're the insurance expert, huh?
No, I'm a hygienist. I'm not.
Yeah, I know. It's so funny.
Most hygienists do not want to talk about insurance in the treatment room. So Eric, you understand everything that we've been through today and all the conditions in your mouth, and are you ready to move forward and get that scheduled?
I'm trying to find someone who's not muted.
Yeah, it's a 207. I got it.
Okay. All right. Thank you. Yeah. So, well, I don't know, Paulo, is my insurance going to cover this?
That's a great question. So what you're asking is your insurance going to cover all of this treatment? Is that right?
Yeah. I mean, I want to make sure they're, that, they think this is an important thing too,
I gotcha. Okay. So you know what? I totally understand where you're coming from. You're paying for that insurance, comes out of your check every month. I mean, you want to maximize that.
Exactly. Yeah.
Right?
You see what I'm talking about. Yeah.
And then, I definitely do. And you're in the big group. This is what most patients want to know as well. So, one of the things I also heard you say is that you want to know if they think this is a big deal or not too. So, can I ask you a question?
Absolutely.
Do you think the insurance company wants you to have the best or the cheapest?
Ooh, man. I think they're hoping that I don't choose the best.
Yeah, it's true, unfortunately. Do you think that they want to be your dentist or do you think they want us to be your dentist? I mean, what would you prefer?
Oh, no, you guys are the experts for sure.
Yeah. I mean, they're not here to see and listen to you and talk about what you just said. So, when we were going through the process of looking in your mouth, we found several things. There was infection, there was the broken tooth, the big crack that we saw. Um, Let me ask you a question. Those are pretty serious conditions. If your insurance said no and they won't cover anything, what are you going to do about those conditions?
They say no. Well, I guess I'm going to wonder if it's really the right thing for me. I guess I got to wonder if I'm really supposed to do it.
Well, that makes sense. That makes sense. So I'm right back up here at listen. So you're saying that if the insurance says no, you're going to wonder if you need to do it. I hear you. A lot of people put trust in their insurance company to give them guidance on what is best. So let me ask you a question. You
Yeah.
mentioned to me that you never wanted another root canal. You didn't want to lose a tooth.
Mm-hmm. Mm-hmm.
So you're at a red light, you're at a red flag with the tooth on the lower left with the crack and the infection. And that's a high risk of losing a tooth. So the insurance company, most of the time they really don't want to pay if they don't have to
Mm-hmm.
because they want to keep their profit. Do you agree with that? Do
Oh,
you believe?
absolutely. Oh, yeah. No, they're all about the money.
So, how do you feel about this tooth being at a high risk of loss, or if it
Oh man,
breaks,
I see
you
what you're
might not be able
saying.
to lose
No,
it?
I
Yeah.
get what you're saying. Yeah. So, look, I don't know what to do. I just want to make sure that they're on board with it. And if they're not, I guess then we got to take a step back and figure out what do I got to do. And
Gotcha.
yeah, I hear
So, you
you.
know what? If there were a way we could fight for you with your insurance, we'll send them pictures, we'll send them whatever they ask for, and maybe even work with your benefits manager at your company to
Hmm.
get this paid for you. Would that make you feel more comfortable?
Yeah, absolutely. That would really help
It's
me.
not a guarantee that they will
Yeah.
pay. Even if we send in a pre-estimate, it's not a guarantee
Hmm.
that
Okay.
they will pay. Did you know that? There's a disclaimer on the
No,
bottom.
and I didn't know that. No, I didn't know that.
Yeah, I mean, they're just a waste of time
Oh
because at
wow.
the bottom it says this doesn't guarantee that we're going to pay it when you have it done. Insurance
Wow.
companies are like that. Isn't that crazy? So, so if there were a way we could fight for you, be your advocate with your insurance company, and do everything we can, is there any reason we can't move forward?
No, I think as long as we can figure that out, then I'd be happy to move forward. I just have to I got to make sure it's the right thing, the right decision.
All right. So how are you
Yeah.
feeling right now about it?
I feel okay. I feel okay. I mean, I feel better than I did a few minutes ago, but
I don't
yeah.
want you to do anything that you don't feel is right.
Okay. I that's fair.
All right. Now, I'm when I take him up front, I got to relay this conversation, right? Okay. So
Got to
I'm
be
going to go
transferred.
up front to Sally and I'm going to say, Sally, this is Eric. Eric and I, we finished the hygiene appointment today, and he's doing great with his home care. We have 3 or 4 areas that we keep checking for gum infection, and see, he's going to stay on his 3 month maintenance. Isn't that right?
That's correct. Yes.
Right. Okay. And so I covered this, and Eric really wants to prevent the infection from spreading, and he's very concerned about a cracked tooth that he has on the lower left, and he's also concerned about this getting paid by insurance.
Yeah.
But he doesn't want to lose this tooth, and he doesn't want to get into pain. Did I get that right, Eric?
That's correct. Yes. Yeah.
So he wants to know if his insurance can pay
Oh,
this.
want my cake and eat it too, Paula.
Yeah. I mean, he really feels that the insurance company is going to lead him in the right direction on this. And I told him we would do everything we could to fight for him to get that paid, even talking to his benefits manager if they deny, and that the pre-estimates are no guarantee that it's going to be paid. So he needs to come back and we need to restore this tooth. And he's going to need a couple hours. And he likes Thursday afternoons because he's off. We haven't gone over the fee yet, but I told him you were the expert and that we have finance options. So, Eric, before I walk away, is there any question that you have for me? Anything that I didn't make clear to Sally here?
No. That's perfect. Thank you.
Okay, so we will see you back to take care of this cracked tooth, and
Okay.
we'll do everything we can to fight for you with your insurance company and make sure you get this paid,
Absolutely.
if at all
Absolutely.
possible.
Yep. That sounds good to me.
And if they don't, maybe you should join our membership plan.
Ooh.
A lot of people are losing money on their dental insurance. Okay. All right. So you see how that whole deal went? This is still in the treatment room where we got the objection. When we asked to close, sometimes we get an objection. And how we transferred that to the admin team so they could be caught up on the conversation, or the patient might just say, send a pre-estimate and then I'll decide if I'm going to do it. Did we just kind of prevent that, maybe, Eric, from
Yeah,
happening?
absolutely. Yeah, I think even showing them an example of what a pre-estimate looks like with the, redacted information, but showing them, look, highlighted, this is not a guarantee of payment. What's the big deal?
I used to keep a file of those up front, and I white out the patient's name, back in the days when we bought whiteout. And put it on our screen, No. But I would black out the patient information and share with them that disclaimer on the pre-estimate. And that stopped a lot of people from asking for pre-estimate. And when we have a approval addicted team, what I'm hearing is the team members are just like volunteering
it. And here, let me send that in for you. Why are we doing that? And let me say something. If you don't know a good idea what they're going to pay based on your history with them, then there's something broken in your system, right? But if you're just trying to do that because you think, oh, this is what I would want, right? That's approval addiction.
So Eric, what about the objection of I'm going to think about it?
Yeah.
We get lots of those, don't we?
Yeah. That's, I think, lack of urgency too. If
Yeah.
you have time to go think about it, it's lack of urgency, lack of trust.
It could be they have a spouse they're afraid of.
Mm-hmm.
It could be any of these objections that we looked at over here. It could be maybe they feel like they don't have the time. If they're an S, the S personality says, I want to think about it more, and the C. The C wants to think about it because they need more information, right? Okay. The S wants to think about it because they know they're living with a D at home. and the D's probably going to say no.
Mm-hmm.
Hey, I need to go spend $5,000 on my teeth. No, you call them and cancel that.
Yeah.
We're not doing that, right?
That happens.
So how are we going to know which objection it really is when they say, I want to think about it? So one way to do that is say, all right, so you want to think about it. I certainly understand that this is a big decision and you want to make sure you're making the right decision for your dental health. Let me ask you a question. Okay? Typically, when patients say to me they want to think about it, they're thinking they're going to go home and think about 3 things. Now, I'm just going to pick 3 out of the 6 objections.
Okay.
I'm going to say, this is your first time here. You don't even know if you can trust me yet. I mean, I totally get that. It could be that, or it could be, how am I going to pay for this? Or, you know what? I'm really afraid. I've had bad dental experiences in the past, like you told Sally on the phone, and I'm just not sure I want to go through the risk of pain. Which one of those 3 do you think it is for you that you're going to go home and think about? Maybe I can help you in your decision. I'm not pushing. I just want to partner with them and get a little more information of where they're coming from. And so they might choose one of those three, or they might choose something else. So, Eric, which one? If I asked you that, you're gonna think
I really just want Abby and I make all the big decisions together. I want to be able to go home and go over the plan with her and make sure that she's on board with it.
that makes sense. That totally makes sense. I'm back up here at listen. So, a lot of people like to make decisions with their spouse, especially big ones. So I respect that. I do.
Mhm.
Um, Let me ask you, what do you think Abby's going to say?
I think she's just going to want to know, um, she's very health conscious. She
Hmm.
really wants things to be healthy. So she's probably going to say what's the best option health wise. And then it's figuring out how to afford it.
Gotcha. Okay.
Yeah.
So those two things.
Yeah.
Sometimes what we talked about today with a lot of patients can be very confusing. It can be detailed. Would it be helpful for one of my team members to contact Abby and just talk with her about what we saw today, or would she like to come in? Or
I don't think so. I don't think that's necessary.
okay,
maybe. If I talk with her and I can't figure it out with her, then maybe we could do that.
okay.
Yeah.
Well, would you please let us know that if she has questions, she's welcome to come in. We'll sit down with her, or we can have a phone conversation
Okay.
and go over that.
Okay.
So, when do you think would be a good time to contact you? Would it be like a week from now?
Sure.
When you
Yeah.
Would that be
Week's
good?
good. Yeah. Week's
Okay.
good.
So I'm going to put you on my calendar to check back with you in a week and kind of just touch base and see what you and Abby have decided.
Okay.
Does that
That's
sound okay?
fair. Yeah. That sounds great.
Cool
Thank you.
beans. All right, very good. So we never know exactly how that's going to go, but when the patient is saying, I just want to think about it, they're not really giving us a whole lot of information, are they?
Mm-mm.
So sometimes we can get to the next level and find out more of what they're thinking about, right? So this was, is this a healthy choice and how much is it going to cost? Okay. Then we can offer to include the spouse. In our practice, we did two full mouth cases a month, upper lower. And those were pretty complex deals for a patient to go home and explain to a spouse. So when we offered, would you like for us to explain it for you? We got lots of takers on that. They wanted us to help
Yeah.
because it
They
was too
felt stuck.
complicated.
Yeah. They felt stuck.
Yeah.
I think the biggest thing here is you got to be willing to spend time
Mm,
to be in conversation with this person. I go, oh, well, they're not in. We're moving on to the next one.
yeah.
That goes back to acres of diamonds and all the unscheduled treatment that's sitting in the chart because we didn't take
It
the
sure
time to
does.
begin with.
What's Acres of Diamonds, Eric?
Oh gosh, Paul, it's such a long story. uh, yeah.
Give us a D version.
All right. So long time ago, uh, farmer in Africa found out that he wanted to. His religious leader said these diamonds. Told him the story about diamonds. He goes, "I'm going to go find diamonds. I need to strike it rich. I'm going to go find these diamonds." And so he decided to sell his farm that he had in Africa and basically travel the world looking for diamonds. He actually spent all of his money, okay, looking for diamonds. Ended up broke. Where did he jump off a cliff in Spain or something, Paula? He
Or I drown in the ocean.
drowned in the ocean somehow, right? So he ends up in this horrible search for diamonds. Meanwhile, back at the farm, the uh, you know the leader, right, this mentor to him, comes back through to the new owner and sees a black rock on the mantle and says, "Oh, well, uh, Ali's back. He's back, right?"
Yeah.
And he found diamonds, and the farmer goes, "No, that's not a diamond. Those are rocks down in the riverbed, all gosh, all over the place. They're all over down there." He goes, "No, this is a diamond. This is a diamond." And come to find out, Ali sold the largest diamond mine on record to go find diamonds, right?
Golconda, I think is the name.
Okay. And Golconda. Yeah. And so a lot of times we go looking for the best solution. We go looking for the diamond when it's right under our nose. And so what we mean by that when we say acres of diamonds is the patients, the $3 million example we did earlier, there's patients right there. We just have to be willing to spend time with them. We got to dig for them. We got to go and search for it. And don't give up on your farm. Don't give up on what you have right now in search of something better, because you have options. It's just a matter of mining it. It's a matter of spending time. So Yeah.
You're absolutely right.
That's the best D version I could do of that story because it's a long one.
That's awesome. That's awesome, Eric. Okay. So, I've stopped recording there. I think Eric,